Welcome back to Search Ahead. We are very happy to be talking today to Dr. Tlaleng Mofokeng. She is the UN Special Rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health, or right to health, in order to simplify. She is a South African medical doctor. She's a broadcaster. She's the commissioner at the Commission on Gender Equality, which is a national human rights institution in South Africa. But also she is known as Dr. T because of her best-selling book called Dr. T, a Guide to Sexual Health and Pleasure. Thanks for being here with us today. I'm delighted. How are you?
Thank you so much for having me. I'm good. We are winding down a very challenging year, but I'm very excited to join you today.
How do you feel when you received the news that you were going to be the new UN Special Rapporteur on right to health? And I know this is part of a lengthy process. And when the pandemic started, did you feel like, oh, what am I getting into?
A little bit, just a little, because it's quite challenging, when you're coming and taking such a big responsibility. I think my concern for me was with the limitations and restrictions around travel, will I be able to fulfill all the different, objectives and the different tasks? And it has been quite, I think for me, firstly, challenging, but also fascinating in that I started just, incorporating the virtual working and doing virtual webinars. And actually, I found that I met more people across the different regions in the world virtually than I would have had opportunity if COVID didn't happen. So, it's almost trying to find that silver lining in a very tough and challenging and heartbreaking situation. Because I know nothing else and no other way of working in this mandate, we've been quite agile and able to just get the work done, with the support of the team at the Human Rights Council.
Thank you very much for the answer. During a virtual roundtable with your predecessors in this position, you said that, here I quote, "Many laws are great on paper, but the impact on health outcomes isn't as expected." Today, the 10th of December, we are celebrating the Human Rights Day, and in 2 days, we will be celebrating the Universal Health Coverage Day. These dates look nice on paper, but how real are these celebrations in, for example, rural areas in Africa?
And it's one of those issues, that really, when communities do not get access to health, when they don't get access to essential services, when they don't get access, for example, to post sexual violence support, all of these issues are human rights issues. And I think for me, what has been missing, right, and we often refer to good policies and good international human rights standards, is to operationalize human rights. It's to make sure that human rights, even in clinical practice, are reflected and expressed. It's ensure that human rights are the backbone of programs and planning. And so when all of us are talking about, Human Rights Day, it's about affirming the fact that without good health, we all have nothing, right? And COVID has unfortunately reminded us of that reality. So the right to health, the realization of the right to health is one of the cornerstones of human rights. And I think it's important when you're looking ahead in 2 days' time, when we are then celebrating International Day of Universal, health coverage. It's important when different countries are thinking of different models, right, of making UHC a reality, is to think and be deliberate and intentional in how we recenter those people and those issues and those people who find themselves in vulnerable situations and recenter them. And I know firsthand the different difficulties of just being geographically located in a rural area where you are so far away from urban centers or peri-urban centers where most of healthcare is usually accessible. So I know that it's important to not only think about the other intersections in terms of health determinants, but also think about access, acceptability, and quality of care in many rural areas where even when rights are abused and violated, those communities don't actually have any opportunities for redress, or justice for those violations. And so it's very important that as we think forward and reimagine a world with universal health coverage, to be intentional about the types of issues that we are recentering, and make sure that all the programs, all the health policies, all the funding and health planning is supported by a human rights framework.
In SURG-Africa, we work to bring a safer and more accessible surgery to rural areas in Malawi, Tanzania, and Zambia. And during the interviews to people living in those areas, in these countries, I've noticed sometimes that, most of the time I have to say, that for them, surgery, or the access to surgery in this case, it is more a privilege than a right. What needs to change in order to transform this reality?
This speaks directly to a lack of human rights training and focus in medical curriculum and undergraduate as well as postgraduate training. And this is, an area I'm quite passionate about, looking at the issues of healthcare workers and the fact that we need to understand that even how you take a medical history from a patient, how you perform surgery, how you treat your patient can in itself be a human right. It is a human rights issue, but it can be in itself a protection and a promotion of human rights. And I think it's important because in many countries where surgery is required, people often see it as an added extra, right? And not understand that, again, access to good quality modern procedures is also a human right. Access to essential medicines is as important human right, but it goes hand in hand with access to life-saving surgery, for example, and that the delays in timeous access to surgical procedures often leads to death and leads to complications and morbidities that are preventable. And so, again, speaks to the issue of health funding and health financing, where you will have district managers or ministries who don't prioritize surgical interventions, who don't plan and finance the technology that's required, and support infrastructure development to then ensure that the rural communities like Zambia and Malawi are able to access scientific and also modern developments in terms of surgical interventions. And you are quite correct, it's often seen as a privilege and a right. But if you think about all the different types of injuries that especially young people experience, and how much in terms of their mobility, in terms of them participating fully, in terms of their political, social, cultural experiences in life, could be improved by just having one simple life-changing procedure. And that's why my focus, even in my mandate, is also on the quality of life. It's not enough to just count the numbers. We need to start asking ourselves, what else can we do to improve the quality of life of the citizens? And surgical interventions that are timeous, that are of quality, are really, really important and can change lives and improve health outcomes in ways that other interventions don't necessarily provide.
You have, not just as a broadcaster, but also as an activist, a wide experience working on health communication. How do you think health communication can help to make health more accessible to people?
This is so important, and I want to just reiterate that human rights and the right to health is interlinked and interconnected to many other rights, and you can't separate the right to health from the right to information. For example, the right to dignity, the right to bodily integrity, the right to autonomy. Because in order for citizens, for rights holders, for patients, for people who require these surgical interventions, they need to know what their rights are. They need to understand what the bodily processes are happening to their body. They need to understand the disease processes and therefore be assisted with information and proper health communication to give informed consent. If you think about all of the different medical negligence cases around the world, and of course in the Southern Africa region, a lot of it starts with proper communications with patients, with clients, or citizens. And I really, really believe that as part of the medical training, we have to undergo not only a human rights enriched curriculum, but we need to be able to communicate better with our patients. And again, I think for me, one of the obstacles around medics and medical practitioners and healthcare workers generally is that medicine is very paternalistic. So even when we are communicating, we are not communicating on the same level with our patients. And therefore, we come across and perpetuate these imbalances of power in consultation rooms. And that impedes effective communication because patients are fearful, they are anxious, they're not sure, how we will take them when they ask us more questions or to explain further. And the issue of languages is very important because speaking to patients in indigenous languages that they understand, that is their first language, also goes a long way, and it actually does improve adherence. And I've seen it, because I'm still a practicing medical doctor, where patients, once they understand why they need certain treatment, when they understand for how long and what the complications are, they can better seek help when things then don't work out, or when there are complications, or when they are having some difficulties. So health communication is an important right that supports the right to health, and the right to information is key to enabled informed consent.
As I mentioned at the beginning in the presentation, you are an acclaimed best-selling author for your book Dr. T, A Guide to Sexual Health and Pleasure. Now, I have to say that I read it, and as a man, I can tell you that I found it very informative and educational as well. And so that's great. But while I was reading it, I was thinking, this might be quite revolutionary, because normally when we think about health related issues and health developing projects to help and support on that topic, we always leave outside, or usually the projects leave outside all those things that you talk about in your book, like sexual health and pleasure are normally out. I don't know any, I might be wrong, but I don't know any developing project that talks about pleasure, sexual pleasure. Do you think that is a patronizing way of thinking, well, like in the example of Africa, African people have enough to have access to surgery. Let's not think about pleasure, sexual pleasure at all.
Yeah, you're absolutely correct. And this was one of the other frustrations, that I experienced as a young medical student. And we used to go out to rural clinics and speak, about STIs, about HIV. And I was in medical school at a time when South Africa was really gearing itself up for one of the biggest, HIV management programs in the country. And everything about sexual health, about sex and sexuality was just basically about avoiding HIV and using fear, right, as a driver, as a tool to drive the messaging. And I found that quite difficult to digest as a young person. And, I've always had an interest in sexual and reproductive health and rights. And again, the activism that I've done in this space is for it, and it was then for my own survival. And it still is, because I grew up in a Bantustan community, a former apartheid, a settlement, and I know not having access to information, not having access to services and clinical care that supports, my transition from childhood into adulthood. And so this book, in a way, was designed to give information to people who absolutely have no information, but also to support and guide those who do have some information in how to better understand their bodies and seek help better, but also be intentional about breaking down the taboos and giving research and evidence-based information. So I'm quite thoroughly indulged and really grateful that you've used the word revolutionary, because I didn't want it to come across too obvious that I was trying to do a lot of work with that book. But I'm glad that you did pick that up, because I tried to be inclusive even in the languaging that I'm using, moving away from this cisgender heteronormativity that often, even when we then actually talk about pleasure, when it's very few times, but when we do, it's always very much around heteronormativity and cisgenderedness. And so I did try and subtly, put these issues in and some of these concepts to try and move the issues forward. But again, a lot of my own colleagues have given me the feedback to say, after reading the book, their own medical consultations with patients have been enhanced, and they are seeing some positive, outcomes and where perhaps before they were limited, right, in terms of information around sexual pleasure, but the conversations themselves were quite difficult between the providers as well as the clients to talk about their relationships, sexual being, pleasure within that professional context. And so I'm quite happy to receive this review. And in fact, in January 2021, we will be releasing an updated version of the book. And I speak about sex and COVID, and other types of relationship, issues that people, I think, will find interesting.
Well, I will be looking forward to reading that, because definitely during the lockdown time, I'm sure that this is a very, very hot topic.
Absolutely.
Thank you very much for finding this time for a little chat with us. It has been a pleasure, and I really know that your agenda is very hectic and you are very busy. So we wish you a really successful mandate, and at least as successful as your book is.
Oh, thank you so much. And I look forward to seeing you in person and then see some of the projects that you are doing. And I'm quite keen to just hit the road again. So thank you very much for the invitation as well.
And for the rest of you, thank you very much for having watched this video. You can access to previous ones on our website, and you can keep in the loop of our activities following us on our social media. Keep yourselves safe and take care.